Thank you for joining us today for this important conversation about COVID-19 and the impact it continues to have on the neuromuscular community. I'm Meredith Guerin, MDA's Director of Care Center Programs, and I'm looking forward to our conversation today. I'm honored to be joined today by Dr. John West Day, who serves as an MDA medical advisor and who is the Professor of Neurology, of Pediatrics, and by courtesy of Pathology at the Stanford University Medical Center. Thank you for joining us today, Dr. Day. We're so glad to have you.
Thanks, Meredith. It's really great to be with you and to work with the MDA community so that we can safely navigate COVID-19 together. I think that the MDA and MDA community has already shown its creativity and resourcefulness in dealing with this pandemic, and that with diligence and perseverance, I'm confident that we can make it through together. And after making it through, I think we're going to be even stronger because of what we're learning at this time. So it's great to be with you, and I look forward to answering some questions and helping people deal with this.
We're thrilled to have Dr. Day here today as a medical expert, but please understand that Dr. Day is not providing medical advice. Any decisions about your care should be made in conjunction with your doctor. We know this continues to be a time of great uncertainty, and we at MDA are here for you. With many parts of the country slowly beginning to open, we know many people living with muscular dystrophy, ALS, and related neuromuscular diseases have questions around how to navigate through this new time. We look forward to spending the next half hour answering your questions. Before we start with the questions, I would like to thank our Facebook Live supporters, Sanofi Genzyme and Amicus Therapeutics, for their generous support of today's program. I also would like to say thank you to everyone who responded to MDA's COVID-19 survey and to those who submitted questions in advance. We will do our best to address as many of them as possible today during the time that we have together. So Dr. Day, let's go on to our first question. Why are people living with neuromuscular disease more at risk if they contract COVID-19?
That's a really great question, Meredith. Neuromuscular diseases, by their very nature, affect muscle strength. And that can affect your arms and it can affect your legs, but it also affects the muscles that control breathing. Since COVID-19 affects the lungs and causes a form of pneumonia, that's a bad combination. So it's not that patients with neuromuscular disease are at a greater risk of contracting or getting infected with the COVID-19 virus. It's that if they do get infected, if they do develop pneumonia, that can lead to a more difficult course because they have the underlying weakness of their breathing muscles.
Great. Thank you, Dr. Day. And I know some people have been curious as to what you're seeing in your practice as it relates to COVID-19.
What I'm seeing in the practice, fortunately, is very few patients that have actually come down with COVID-19. So that's the good news. And I think that it's already beginning to demonstrate that we do have ways that we can deal with this, that we can, through diligence and care, prevent the infection. What it has also done to our practice, though, is it has necessitated a new way of seeing patients. So across the country, all care centers have very rapidly adapted or expanded their ability to carry on virtual or video contact appointments with patients so that they can be providing care indirectly. We'll get into this more, I'm sure, as we address more questions. But that's the biggest effect we've seen now, is that we're finding new ways to help meet the needs of patients without putting them at greater risk.
Great. And what are the best precautions the neuromuscular disease community can take to prevent getting COVID-19?
The most important thing is to do all of the usual care recommendations that have been provided to the entire community. So social distancing, wearing a mask when you do leave the home, washing your hands frequently, especially before you ever touch your face or your mouth, using hand sanitizer if you don't have access. I think it's very important to realize that these really do work. And I think there's no better example than what's been going on in Hong Kong. I mean, in Hong Kong, they did not have a strong a top-down kind of an approach to managing this disease, but really just everyone began very quickly to practice social distancing and wearing a mask. Hong Kong is about the same size as New York City. There are about 8 million people in both. In Hong Kong, there have been a total of 1,000 cases of COVID-19, whereas in New York City, there have been 200,000. In Hong Kong, there have been 4 deaths from COVID-19, whereas in New York City, there have been 20,000. And I think that's solely and totally because of this managing the way of dealing with COVID-19, wearing masks, practicing social distancing, washing hands, and things like that. So these things sound simple, but they really do work.
It's such a great example that truly illustrates just how important these preventative measures are. And Dr. Day, we've received quite a few questions around different forms of neuromuscular disease and if they are at greater risk. Would you say all people living with neuromuscular disease are at an increased risk of COVID-19?
I don't think they're at an increased risk of getting infected. I think that they, as I said before, might have some different challenges or difficulties if they do get an infection. So it's not that the risk of getting infected is higher. And again, I think that we can mitigate that risk through the common public health means that we've discussed.
Great. And with many parts of the country beginning to reopen, what should families living with neuromuscular disease do? Should they continue to stay at home, or is it safe to return to some activities outside of the home?
I think it's very important that patients and families learn how to go outside the home, because there will be things that you need to go outside the home to do. One, for instance, is getting vaccinations, so that when the influenza vaccine becomes available, I think it's very important that our patients get that. That cannot be provided by video visits, video medicine or telemedicine. You have to go and see someone to get that vaccination. The same is true for all children with their routine vaccinations. It's very important that we keep that schedule on track so that we don't complicate COVID-19 by having a bad flu year or bad waves of other infectious diseases. So that there are things that are important to do outside the home, and I think it's important that we reach that balance. I don't want people just locking themselves away and thinking that that's optimal care. There are ways of doing it safely. You can go outside the home. Our country is incredibly individualistic, and so that puts more burden in terms of maintaining your health on the individual and the individual family. You have to make sure that you're doing the social distancing and hand washing and hand sanitizing and mask wearing. You can't count on everyone else to do it, but I do think there are ways to do it.
And Dr. Day, I know you are one of the principal writers of the Pulmonary Guidelines for Neuromuscular Disease Patients with COVID-19. Could you share some information on what's included in those guidelines?
Yeah, I think that's a very important issue, and a lot of us recognize the importance of it at the very early stages of this. The concern has to do with the way we provide breathing support to patients with neuromuscular conditions, so that we oftentimes use what are called positive airway pressure devices that actually push air into the lungs. And the risk in COVID-19 is that anything blowing air into the lungs has a risk of spreading the virus more if a patient is infected. So that's the risk, and that's the balance that we have to deal with. We normally say that there's a recommended distance of 6 feet in terms of social distancing, but if you're blowing air in, the distance the virus spread goes way up beyond 6 feet, so that it gets to be a greater issue. And that affects how patients are dealt with if they go into a medical establishment, because the medical providers are themselves concerned that if you might have COVID-19, you might be spreading it throughout the medical institution. And so that's where the guidelines came from, is helping people and providers come up with ways that they can provide the necessary ventilatory support, but to do so safely without increasing the risk of spreading the virus. I think patients need the breathing support that they have. They need the care that is given, oftentimes, again, through positive airway pressure devices, the cough assist and things like that. That is an important part of their medical management. If they don't get COVID-19, those things are fine. There's no risk of them other than in association with the actual infection. So that by all means, continue to use them, continue to follow the recommendations of your pulmonologist or neuromuscular care specialist, but you will need to be thinking about how to deal with it if you have to go into a medical establishment where they may be concerned about whether or not that's increasing spread. So you get into the weeds here very quickly, and I do recommend for each individual that you work this out with your providers. There are ways to do this safely so that we can make sure people keep the support that they need to stay healthy, even in this COVID-19 period.
Thank you. And for those of you who wish to share these guidelines with your providers, you can view the guidelines on MDA's COVID-19 resource page under the Guidelines for Healthcare Providers tab. Okay, let's go to our next question. What do you recommend for muscular dystrophy patients that stay at home but need to be active?
I think that's a very important issue, and obviously exercise and maintaining your activity is critical. We want you to be able to maintain flexibility. We want you to be able to maintain conditioning of the muscles and a sense of balance and overall function. And, we all know that a period of increased sedentary behavior takes a toll on our function. So that is a critical issue. And that's been another area that we've expanded. Not only do the physicians provide video visits now, but our therapists do as well. So the physical and occupational therapists will work with patients at home by a video visit to make sure that they have exercises that they can do safely to help maintain their overall function during this period.
Great. And the next question comes from the parent of a child living with SMA, and it reads, my daughter has SMA and uses a cough assist, shake vest, and a BiPAP as a preventative treatment. Will these devices help protect my child against COVID-19?
That's a really critical issue, and I'm so glad that has been addressed. And I think that the point, as I was making earlier, is that it's very important that you continue to use the devices and take the care that has been recommended to you, so that you do want to do that. They will not decrease the risk of contacting the virus, so that you contact the virus because you come in contact with someone who is carrying the virus or is themselves infected. And that is how you get the COVID-19 virus. But you need to be maintaining excellent care to make sure that if you do get infected, that you have as good health as possible when you start dealing with it.
Great. And are there concerns for people who have respiratory issues to wear masks for long periods of time?
That's an interesting question, and I really kind of wonder what the questioner is thinking about. I think all of us who wear masks for a long period of time feel it. I mean, there's recognized problems with headache and pressure on the skin and things like that. So those concerns are universal. But people, again, with neuromuscular conditions can have reduced breathing efficiency, so that wearing a mask can make that breathing efficiency even less. It can increase the work of breathing. And this is a balance issue. I think all of us can notice this. If you wear one of the surgical N95 masks and go out and try to run, you'll notice very quickly that it really interferes with your ability to function at the level that you normally would. So that there are issues that can come up. It can increase the work of breathing. And I think you need to balance what you're asking yourself to do with what you're going to be able to do with wearing a mask, so that maybe you shouldn't be going out for as long. You should be staying in an environment where you don't need to use a mask, because it can interfere. Again, this is very individualistic and needs to be worked on with your providers to get to a specific solution.
So helpful. The next question reads, I'm hearing about new symptoms of COVID-19 that have been seen in some children. Can you talk about what those symptoms are and how concerned I should be for my child who has DMD if he contracts COVID-19?
Yeah, another really great question. And it really brings up the point that we're still learning a lot about this virus that we didn't know about initially. So we've always thought appropriately that this is a form of pneumonia, and it is. But what we've also realized that the virus just can kick up a huge inflammatory response that causes its own downstream challenges. So it can affect the blood vessels, it can cause some blood clotting, it can cause different things, not in nearly as high a frequency as it causes pneumonia, but those things do occur. Fortunately, one of the things we can say is that children have consistently shown less severe responses than adults. And so that is very true. There are children that have shown these unusual features, really just reflecting that inflammatory response and the secondary consequences of it, without showing the severe pneumonia. So it does happen, but it's much lower risk than the other things that we've been talking about.
It's very helpful. Thank you for sharing that. Our next question reads, what are the at-home respiratory protocols you would recommend for those with SMA if they get COVID-19?
So again, you're going to want to follow the guidelines and the protocols that you have established with your provider, so that most people with neuromuscular disease will already have a plan in place. So that if you got a respiratory infection, whether that's a cold or bronchitis or pneumonia, that you would know exactly what to do, that you would maybe start using a certain nebulizer, or you'd be using your cough assist, 4 times a day as opposed to once a day, or using the vest, 4 times a day, or whatever the plan is. Those are the kinds of things that you will want to do with the COVID-19 as well. But the most important thing, I would say, is make sure that you are immediately in contact with your neuromuscular care providers and neuromuscular pulmonologists who can really work with you to assure that you are managing your condition appropriately. It might require some different monitoring so that they can know how well you're doing and whether or not you really need to come in so that we can give you more aggressive care in the hospital.
Thank you. And our next question reads, I'm concerned for my child and the possibility of him going back to school if they reopen this fall. Do you feel it will be safe for children to be in school next year?
That's another really important question, and we're still finding our way there. I think that there's an awful lot of creativity going into this opening up of schools. The idea is not really, in most places, to just automatically go back to the way things were, but to do things in a somewhat different way. Maybe you would have some children coming in on one day and others coming in on a different day, or staggering things so that people are not bunched together as much as they were previously. So I think there are going to be ways to do this. I think there are going to be ways to do it safely. I go back to my image of the way that Hong Kong has dealt with things. So I think this can be done safely. But again, we need to take a lot of the ownership of the way this is done on ourselves, so that we're going to do this with masks, with social distancing, with hand cleaning, and lack of face touching to get through this. But that's a great question, and we're just going to have to come up with better answers as we go along.
Similarly to taking the approach of pivoting the way that we're doing things, the next question reads, I swim at a gym for fitness and don't know when I can return. Is having a lane to myself enough social distancing? or should I stay out of pools until a vaccine is found?
So I hate to give just a blanket answer to this, but that's a pretty risky situation. So that the situations that we know are of increased risk are those that are indoors as opposed to out of doors, those where people are gathered in proximity to one another, and those in which people are breathing more heavily. So exercise certainly does that and makes you breathe more heavily, so that if there's somebody in the pool who has COVID-19 and they're breathing hard as they're exercising, they have a chance of really spreading that virus in a greater radius than we normally think of. So I don't think that's a very safe environment for the most part. I think there are ways to mitigate that risk again. You know, that if everyone is being tested, if we know people don't carry the virus, then you could theoretically be doing this in a safer way. And there are examples of that around the world. But I think that in all likelihood, we're not going to achieve that degree of safety probably until there's a vaccine, but we'll know more as this goes forward.
Our next question reads, I have an upcoming medical visit that is scheduled to occur in person. Is it safe for me to go in person, or should I see if they offer virtual visits?
I'm not sure it's an either or. I definitely would encourage you to see about virtual visits. Almost all of the MDA care centers have launched virtual visits and expanded their availability. And I strongly encourage you to get used to that. I think it's a great service. I think that it's going to be with us after COVID-19. I think it provides a number of very positive elements that we are going to want to keep. At the same time, I think that you're going to want to be able to go in for some aspects of care. So I think the one thing you can be sure of is that the medical centers are working very, very diligently to make sure that they can provide care safely, so that you'll see when you talk to the care centers across the country, irrespective of what state you're in, that they are very careful about how many people they have come in at once, you know, what kind of provisions they have to make sure that you see only the minimal number of people when you're there, that everyone will wear a mask and so on. So I think that you can be confident that it will be safe when you go in, but you might want to take advantage of the virtual visit as well.
And if you're unsure about what a virtual medical visit is or what you can expect from a virtual medical visit, MDA has an on-demand Engage webinar sharing details on this type of visit. Go to mda.org/engage/telehealth to learn more. Our next question comes along the lines of self-isolation. Many of us are self-isolating, and it seems our greatest risk comes from those who enter our personal spaces from the community. As reopening occurs, what are the most effective protective protocols or processes that we can put in place with regard to caregivers we have working in our homes?
Again, a really important issue, because obviously we need caregivers to be available to provide the services that they do. And so we have to be able to do this safely. I think fortunately, testing has become much more available. So even asymptomatic patients can get tested to make sure that they're not carrying the virus before they go into the home. Certainly, if they've had any symptoms of having a respiratory infection, they should not be going into the home. If they know that they've come in contact with someone who has COVID-19, they need to not go into the home until they've proven that they are not infected one way or another. And then when they do go into the home, they always need to be wearing masks. They need to be confident that they're going to wear the mask the entire time they're there, and not allow any spread of any virus that they potentially could be carrying into the home. So I think there are layers of support that we recommend. And then obviously the people in the home are themselves going to be wearing a mask when the provider is in the home, and washing hands and using a good technique throughout the visit. So I think there are ways to do this. I think that we can come up with ways, but again, it's a matter of following those rules and getting testing where needed.
Right, and planning is so important, and that's a great segue into our next question, which reads, what plan should I have in place if I or my loved one gets sick with COVID-19?
I think that's a really critical issue, and I really commend someone for bringing it up, because I think it's all too easy to just cover our heads and not want to deal with that. But I think we need to know, how would we deal with it if this caregiver, became infected, or if the patient became infected, or someone else in the house became infected? And obviously there are many aspects to any solution to that, and to coming up with a strong plan. So our care centers, the care coordinators, the social workers can all provide some insights and support to help you come up with a tailored plan that really meets your needs for each of those potential eventualities. So I commend you for asking the question. I think if you can get a plan in place, you will rest assured that you have a solution in hand if need be, and then we can go back to making sure that none of us actually get infected.
Absolutely. And through MDA's Strongly blog, we have been asking for providers to share information with the community. And we have a great blog article written by Jana Unislawski, who is a caseworker, that covers the topic of creating an emergency care plan during COVID-19. The link to this resource will be typed in the comment section. Our next question reads, is it safe for my 16-year-old to get a job this summer?
And so I guess this is also evolving. Obviously, there are really important jobs out there that we want people to be able to partake and to participate with. And your 16-year-old could be a great, could contribute significantly to the society in that way. So that would be wonderful. And I do think it can be done safely. Again, following all the rules that we've already gone over. I think it can be done safely, but you can't count on others to be doing it. You have to do this all for yourself.
Absolutely. And our next question reads, I have no choice but to fly internationally in the coming month. Do you have any tips for minimizing risk for a young person living with SMA in this situation?
So that's a challenge, and I recognize that you recognize that it is a challenge. I do think that you're going to want to wear a mask. Ideally, you would get one of even the surgical masks, the N95 masks. They help not only prevent you from spreading it, but they help prevent you from contracting the virus as you're out in a situation like this. But you would want to take hand sanitizer with you. You'd want to take sanitary wipes to wipe down any of the surfaces that you come in contact with. You want to make sure that there's no one sitting close to you throughout the flight. There are ways to do this, but I think it is a challenge. And we come back to that issue we already discussed about whether wearing masks makes your breathing more difficult. And obviously that's an individual issue.
And Dr. Day, as a follow-up to that question, would you recommend the use of non-invasive ventilation as a safety measure for the duration of the flight?
If you require non-invasive ventilation at home, then you should take it with you by all means on the flight. I don't think of it so much as a particular safety measure. I think, the safety concerns in an airplane have to do with the air circulation within the airplane and the fact that anyone in the airplane could be the source of virus that could get to you. So that the non-invasive ventilatory support provides little increased safety for that. There is a potential additional filtering system involved, but it really doesn't get around that, and it probably adds to the concern. I'm not 100% sure that all airlines would be supportive of your using inessential non-invasive ventilatory support. So you'd have to check with them on that. I'm not sure what their rules are.
Great. And our next question is about clinical trials. And it reads, I'm concerned about the impact this pandemic is having on clinical trials. Are clinical trials slowing down or being put on hold because of the pandemic?
Yeah, the short answer is yes. They've definitely taken a hit and slowed down, and many have not opened because of it. I have to say, though, that's not universal. We have opened new trials during COVID-19. We have continued trials where people were getting essential treatments so that they could continue to come in and get those treatments. So that this isn't a complete stop for everything. I think it just introduced new concerns that we needed to be careful about. I think it's forcing us to adapt and to get more creative, and we're coming up with new ways to do trials that will allow us to go forward. And I think already we're seeing these open up more, and the trials are really getting back on track. So it's had an effect, but it hasn't stalled us out completely, and I think we're adapting to it.
How close are we to a vaccine being developed for COVID-19?
It's hard to know until we actually know, because drugs can look good for several of the steps along the way and then not really meet the needs, so that they have to get through all phases of the clinical trials to prove their merit, and we'll see. But there's a huge effort. I mean, so there are like 130 different companies that are developing vaccines. And, there are some that are in clinical trials, some in phase 1, some phase 2, some phase 3 trials, so that we just have to wait and see. The trials will establish whether they're safe and whether they're effective. And once they're proven, then you can go to the next stage, which is mass producing and distributing them. So that I think there's a lot of work to try to do some of these steps in parallel rather than in sequence. And I think that we'll just have to see, maybe we'll have a virus available a year from now. I think that would be really, really the best we could hope for right now, to actually have something available that we could use. But we'll see. We won't know, as I say, until we get some more data.
And when a vaccine is available and is approved for COVID-19, would you advise patients to get it right away?
Almost certainly. I mean, we're going to need to get the specifics about it so that we know exactly what we're talking about. But in order for a vaccine to actually be rolled out to the general population, it will have to be proven to be both effective and safe. And so I think that will mean that our patients will be deserving of it and probably be prioritized to receive it. But I think we have to get the specifics before you can say that definitively.
Dr. Day, this is our last question. It reads, I heard about the antibody testing being available. How crucial is it for people to obtain an antibody test?
Well, right now, it's not very crucial at all. I think there's a lot of different tests being done and a lot of variability in the responses and the interpretation. The point of the antibody test is to show whether or not you were infected when you didn't know it. If you know that you were infected, then you almost certainly have some antibodies to the virus. So this is of value only in discovering people who were silently infected and weren't aware of it. It's not clear whether or not having antibodies really protects you from getting or carrying the virus going forward anyways. And so there are several elements here that are unclear and hard to kind of use in a practical way. So as of today, I wouldn't say it's very critical at all for anybody to get antibody testing.
Great. And those are all of the questions we have time for today. Due to the pandemic, we at MDA are having to think of new and innovative ways to fund our mission, as well as new ways for us to connect with the community, such as through these Facebook Live events. I would again like to thank Sanofi Genzyme and Amicus Therapeutics for their support of this program. I also would like to remind our Camper Age family community that while we're sad that we won't see your child in person at MDA Summer Camp this year, we're thrilled to offer virtual summer camp, and registration is now open for our campers at mda.org/virtual camp. Thank you for attending today's Facebook Live event. If you're unable to join the full conversation, the recording will be available for playback on Facebook as well as at mda.org/COVID-19. Dr. Day, I would like to take a moment to thank you for all that you do for MDA and our families, and so much for joining us today.
Well, thanks, Meredith. I think this has been a great conversation. I really hope that everybody takes heart. I do think we can get through this. I think we've already shown that the methods exist to get through it safely. And I really do think we're going to be stronger because of it, because I think we're learning all kinds of new ways to help the MDA community that will be of great value after COVID-19 as well as now.
Absolutely. Please stay tuned for additional community updates through MDA's COVID-19 response page, as well as on MDA's Facebook page. Please never hesitate to reach out to us at MDA. We are here to help. Thank you again for joining us today. All of us here at MDA wish you well and good health.